Hello again and welcome to another Upgrade Your OET speaking roleplay with me, Sona. In this session, we're going to be having a look at a diabetes roleplay because one of my YouTube students, Mayan, I hope I pronounced that correctly, had requested some help in speaking to patients about diabetes. And actually, this is a great topic to look at, so I thought we'd have a look at that today. And thanks very much for your question. So this session is going to be focused more on doctors, but it could be a useful role play for nurses too. But don't worry, it's going to be useful for everyone because we're going to be looking at that all-important everyday lay language that you need for your OET speaking role plays. We're going to be looking at some phrases that you can use, in particular when information giving, and we're also going to focus on pronunciation. We've got loads of videos actually available for you, so do take a look at some of our other ones, perhaps another vocabulary quiz or some reading help or writing help as well. And if you do like these videos, then please don't forget to click that like button, share this with a friend or colleague and subscribe to us. Okay then, so first of all, how can you explain what diabetes is to a patient? Diabetes mellitus, of course. However, I'm not a healthcare professional, so my medical source comes from a reputable source such as the NHS. The website is below. Can you fill in these gaps to explain in lay language more about diabetes? Have a look through. Diabetes is a condition that causes a person's blood sugar level too high. There are two main types. Type 1, where the body's immune system and the cells that produce insulin, and type 2, where the body does not enough insulin, or the body's cells do not to insulin. How can you fill in those gaps? Well, you could say diabetes is a lifelong condition. So here we have an expression which means that it will be with you for life. It's something that will not go away with medication. It causes a person's blood sugar level to become too high. Medically, we might say elevated, but when we're talking to patients, we would say become too high. Type 1 is where the body's immune system attacks and destroys the cells that produce insulin. And type 2 is where the body does not produce enough insulin or the body cells do not react to insulin in the correct way. The symptoms of diabetes, of course, are these here, and we're really going to focus on pronunciation because we've got some tricky words coming up. So a patient may be feeling very thirsty. This is an R sound, thirsty. But the R is quite soft in British English, thirsty. Peeing more frequently than usual, particularly at night. Peeing is going to the toilet, urinating, peeing. Feeling very tired. This R is silent, tired. They may be experiencing weight loss and loss of muscle bulk. Here, listen to this. Muscle bulk. This C is silent, muscle bulk. They may be experiencing itching around the penis or vagina or frequent episodes of thrush, itch. Or they might have cuts or wounds that heal slowly. Wound. Or they might be experiencing blurred vision. That's when they can't see clearly. Blurred vision. Blurred vision. So we have thirsty, peeing, tired, muscle bulk, itching, wounds, and blurred. And those are the typical symptoms of diabetes. How can you treat diabetes? Well, there are no lifestyle changes you can make to lower your risk of type 1 diabetes, but you can help manage type 2 through healthy eating, regular exercise, and achieving a healthy body weight, your BMI. If you're diagnosed with diabetes, you'll need to eat healthily, take regular exercise, and carry out regular blood tests to ensure your blood glucose level stays balanced. What about treatment? Well, people diagnosed with type 1 diabetes require regular insulin injections for the rest of their life. And for type 2, it's a progressive condition, so medicine may eventually be required, usually in the form of tablets. Now, my question for you then is an interesting one, I think. What is pre-diabetes? Have you ever heard of this? And if so, what would you ask a patient to do with it? Well, of course, prevention is much better than cure, and in the UK, there's a big pre-diabetes screening program. Many people have blood sugar levels above the normal range, but they're not high enough to be classified or diagnosed as having diabetes. However, they are in that danger bracket, they're in that danger zone. This is sometimes known as pre-diabetes, and if its blood sugar level is elevated, if it is above the normal range, then your risk of developing full-blown diabetes, full diabetes in other words, is increased. It's very important for this to be diagnosed as early as possible, because if it's untreated, if there are no changes made, then things will get worse. So there is a very big program, as I say, in the UK to check if people are pre-diabetic, and if they are, there is a prevention program to stop people from becoming diabetic. It's a systematic approach to reducing the risk of individuals developing diabetes. The program could include wearable technology, so maybe wearing or linking your phone or your smartwatch to monitor your levels of exercise. There are apps which encourage people to access a health coach, either virtually or on YouTube or something like that. There are online peer support groups, and there's the ability to set and monitor goals electronically. There are lots of programs available across the UK to help people do this. The doctor might refer you to a dietitian, for example. Okay, so let's now have a look at a role play. This is between a doctor and a patient, but as I say, have a look at this anyway, even if you're a nurse, even if you're a pharmacist, because I think this is good knowledge to have, and we're going to practice that information giving as well. First of all, I'm going to show you the role play and give you 3 minutes, like you have in the exam, to have a look through and prepare what you're going to say. Okay, so we've got some interesting things here. This is a patient who's coming back to you and you have to explain their blood test results. This, of course, needs to be done quite sympathetically. They are pre-diabetic and you need to explain this to them. Explain why you've done this test. So probably they're a bit surprised here. And then you have to explain what diabetes is. So this refers back to what we've already looked at. You've got to advise the patient on making lifestyle changes and stress the importance of making these changes before it's too late, really. So let's have a look at how you can explain the result of the blood test. Of course, you greet the patient and welcome them back in, but how would you explain the result? Well, you could say something like this. We've got your blood test results back, and unfortunately, we've found that your levels of something called HbA1c are higher than we would like. So you're giving them the results, you're signalling to them that things aren't as they should be, you're giving them the technical term, but then you're explaining to them that it's too high, it's higher than we would like it to be. Now, what this means is that at the moment you are currently classed as being pre-diabetic. But the good news is, because we've spotted this now, there are steps we can take to help prevent you from becoming diabetic. So this is the key thing here. You've given them the message that they are pre-diabetic, but trying to be optimistic, the good news is they can take steps to prevent themselves from becoming diabetic. I'm using we so that it's nice and inclusive. It's not them alone. You're going to be helping them. How can you explain the types of diabetes to the patient? Can you remember? So there are two types of diabetes. Type 1 is where the body's immune system attacks and destroys the cells. And type 2, which is the one that you are in danger of getting, is where the body does not produce enough insulin or the cells do not react to the insulin. So your blood sugar levels rise and this can be dangerous. How can you explain why you've done this test? The reason I requested the blood test result was because you were actually showing a lot of the symptoms of diabetes. When you came in to see me last week, or whenever it was, you told me that you had a thrush infection and you were more tired than normal and wanted to go to the toilet more often. Do you remember the word? And wanted to pee more often. Your BMI is also 24, which is a bit higher than we would like it to be. And as we get older, we are more at risk of diabetes. So over 40s typically get checked for the condition. Now, how can you advise them that they need to change their lifestyle? This is never easy. It's very hard to change your lifestyle. So what can you say to encourage your patient? What I'd like to suggest. So you're giving them a suggestion, it's not an order. What I'd like to suggest is, so you're giving them that bit of signalling first before you actually make the suggestion, is for you to make some simple changes to your lifestyle and see if we can get your blood levels back to normal. There are things you can do, like reducing your weight, taking more exercise, and watching what you eat. And then here, you can probably guess that the patient doesn't want to do that, so you need to stress why this is important. Emphasize the importance of making these changes before it's too late, and suggest that they enroll in a pre-diabetic program, because working in a group, in that peer group, if you remember, is often quite helpful. What's really important here is to take action before it gets any worse. So this is a nice expression to stress something. What's really important here is to take action before it gets any worse. Diabetes is a very serious condition that can lead to blindness or amputations in the worst case scenarios, so it's much better to tackle this head on if we can. So you're giving them the worst case, but it's much better to tackle this, to solve this if we can, head on, right now, straight away. At the moment, you're lucky because you don't need medication. And of course, it's much better to avoid taking medication if some simple changes can do the trick instead, can solve the problem. What I suggest is that you enroll on a pre-diabetic program. etc., etc. Okay, so I hope you found that useful. If you want to practice with a friend or a colleague, here is the patient card. Take a screenshot, have a go, and see how you get along. Why not let me know if you've tried this as well and how you did? Thanks very much for watching this. Please share this with friends as well. Let them know about these role plays if you like them. And if you've got time, watch another one right now. If you want more information about our on-demand courses, I'm going to put some codes in the information box below, which will also give you a discount. Thanks for watching, take care, and see you again next time. Bye-bye.